What are the myths surrounding arthritis and exercise?
Most people think that if their joints are painful or hurting, that they should actually rest them, relax a little bit more, take it easy, and that's not the case at all. You actually need to exercise, keep your joints moving, and strengthen them.
And so what are the benefits of exercise for someone that suffers with arthritis?
It actually helps to improve your ability to do your normal activities of daily living by increasing your joint range of motion, increasing your strength, joint stability, just your overall improvement in life and other activities.
Are there certain types of exercise that are better? What exercise is best for arthritis?
There's various exercises. You can do stretching, which needs to be gentle, but it needs to take the joint through the full range of motion so that you can maintain the full integrity of the joint. Strengthening exercises that will actually strengthen the joint to help take some of the stress off of the joint itself and add stability to the exercises, and endurance activities that help to build the cardiovascular system and also allow you to increase your tolerance in doing your daily activities.
Let's talk about warming up. How important is warming up first before you exercise arthritic joints?
It's very important, especially if your joints are inflamed, hot, irritated. You want to warm up slowly. Maybe use some moist heat, maybe take a warm shower, and then do some gentle range of motion, gentle stretching, no bouncing or repetitive motions that will aggravate the joint itself.
Well, what's the best exercise program for the beginner that has arthritis?
First off, you need to, if you have arthritis, you need to check with your doctor to see if a different exercise program or certain exercise programs are needed for you, and if it's okay for you to exercise because of other medical issues. Then you need to see if they will possibly refer you to a physical therapist or an occupational therapist who can help you develop an exercise program individually suited to your needs. And the occupational therapist can also help you with daily activities that will take some of the stress off of the joints.
Well, let's give me some examples of exercises that somebody would be doing if they're just getting started with exercise and having arthritis.
Okay. One would be water aerobics. If you're a person who likes to swim, then water aerobics would be a good program for you. It would be something that you would stay with a little bit better if you do like to swim. If you like doing things with groups and you like to be in social surroundings, then doing programs in group therapy or through the Arthritis Foundation. They actually have different programs in most of the cities across the United States. And that helps with accountability because you'll have other partners that you work with and form friendships. And if you prefer to work solitary or alone, there's good exercise DVDs out there that you can get, work at home. You can work with your physical therapist who can develop a program for you to work at home also.
Let's talk about seniors, older people. How should they exercise to improve their arthritis?
That is a little more delicate because a lot of seniors feel that whenever their joints are painful or sore, that they actually need to sit down and rest more, not do as many activities, and that actually ends up being a huge hindrance to them. They need to first, like other people with arthritis, talk to their doctors and make sure that it is okay for them to start an exercise program. But you need to help to educate them a little bit and let them know that starting exercises doesn't mean they're going to go out and start jogging or even walking quickly, that it can be something that they can start slowly. They can have small goals and build up to larger goals, that the exercises will actually help them improve some of their activities that they would just naturally do around the house that they've lost their ability to do because of the arthritis.
Are there activities or exercises that someone with arthritis should avoid?
Yes. You don't want to do exercises that pound the joints. Although some arthritics can jog, it's not necessarily a good exercise for most people with arthritis to do. Also, repetitive motions. You don't want to do those type of exercises because it can injure the joints.
What happens to someone with arthritic joints when they aren't active and they don't exercise?
They actually become more painful, more stiff, they get weaker, they lose their ability to do their normal activities of daily living, they can lose their socialization and leaving the home, they become more recluse. It's not a good idea.
Can you recommend any books or DVDs on exercise that you might recommend to people with arthritis?
There's various publications out there and various books. Of course, you can go to the bookstores and look, but also the Arthritis Foundation is an excellent place to start. You can go online, look at the different programs that are available. You can also look up the Arthritis Foundation in the telephone book, as it is offered in most cities. Call them, they'll be glad to send out pamphlets, booklets, to give you ideas on various exercises that you can do.
Very well. Laurie, thank you very much for joining us today.
Thank you very much.